For part 5, we're moving into behavior therapies. Now, this is the part of the chapter that I actually most closely relate to, mostly because our behavior therapies end up relating to the behavioral perspective, which falls under the same kind of research that I do. So when we start talking about operant and classical conditioning, very, very briefly, I promise, that's the kind of research I've done. So this type of therapy makes a little bit more sense to me because it's something I relate to. But for our behavioral therapies, back to the actual content, behavioral therapies operate on this belief that our maladaptive behaviors are the problem itself, not a symptom. So in all the other types of therapies that we've talked about so far, they've talked about these maladaptive behaviors, the things that we're doing, as having been caused by something else, where if you can get to the root of the cause, by fixing that other problem, we can fix those maladaptive behaviors. In behavior therapies, we're focusing on the behaviors themselves. So we're saying that these problem behaviors, these maladaptive behaviors that we're exhibiting, they are something that we have learned, and they themselves are the problem. So if we're going to fix these maladaptive behaviors, we're going to focus on fixing those behaviors and not try to get to the root of where they came from or why they're happening or what's driving them. We're just going to target the behaviors. So the idea here is that these maladaptive behaviors could be unlearned through classical or operant conditioning, through modeling. So if you're going to learn something else instead, so instead of doing a problematic behavior, so instead of a child screaming at the supermarket, maybe we get them to do something else. Or maybe we get them to unlearn that screaming behavior. So let's start with our classical conditioning treatments. So if you remember back all the way to 104, you would have talked about classical conditioning as Pavlov's research. Dogs who would salivate automatically when they heard the sound of a bell because they had learned to associate that sound of a bell with getting food. So classical conditioning works because we've learned an association with some kind of stimulus. So for Pavlov's dogs, they learned an association between the sound of a bell and getting fed food. So the behavior that we see, that salivating, is coming from the association that they've learned. So if we want to stop that association, if we want to stop that behavior, maybe we're going to get them to do something else. So when we're talking about exposure, we're going to be talking about trying to go through an extinction approach. So if we're trying to get them to stop a behavior through exposure, so we're going to make them stop doing a particular response because of a particular stimulus. So exposure therapy is very, very commonly used for phobias, fears of very particular things. So let's use arachnophobia as our example, a fear of spiders. So if you wanted to treat that fear of spiders, if you wanted to stop someone's behavior of being afraid of spiders, then what we would do is expose them to the feared conditioned stimulus. You might remember that classical conditioning loves their short forms. So I will use the full terms to make it a little easier. But if you have that feared conditioned stimulus, you're seeing a spider, but it's in the absence of an unconditioned stimulus, say the spider biting you or doing something aggressive, then we can stop your conditioned response, your fear response. So if you can force someone to be exposed to a thing that they've learned is scary, then over time, they will slowly learn that because they're seeing the spider and nothing bad is happening to them, they're not being bit or attacked or anything scary like that, that maybe seeing spiders isn't so bad. So the constant exposure to the thing that they had learned to be afraid of, to their spiders, leads them to slowly learn that it's not actually that scary. Now, in terms of this exposure therapy, you'll sometimes see the term response prevention. And this is basically their fancy way of saying that you keep the person from having their big fear response to the thing that they've learned to be afraid of. So you don't have your conditioned response to the conditioned stimulus. And again, a fancy way of basically saying, with our example, you keep them from running away when they see a spider. So if you prevent them from running away, from doing that conditioned response when they're exposed to the conditioned stimulus of a spider, then you can help them to start realizing that the conditioned stimulus isn't that scary. So there's that extra step of you kind of have to force them to be there, to experience that conditioned stimulus in a safe way so that they learn that it's not scary. And if you remember back to talking about learning, some of our learned responses, especially when it comes to phobias, they're kind of self-reinforcing. So that conditioned response of running away when you see a spider actually ends up itself being reinforced through things like operant avoidance, which I won't go into a bunch here because you would have covered it in 104, and it isn't super important for what's going on here. But it's basically the idea that if you leave the room that has a spider in it, because you're away from the spider, it feels better. And that feeling good is reinforcing. So the next time you see a spider, you think to yourself, maybe unconsciously, last time I saw a spider, I ran away and I felt better. So this time you see a spider, you're going to run away really quickly. You've developed an avoidance response because you know that avoiding that scary thing, that conditioned stimulus, actually makes you feel better. So you need this step of response prevention to keep people from learning that running away makes them feel better. So exposure therapy has lots of different moving parts to it. Now, if we're talking about types of exposure, you could use a flooding technique where you would expose them to a real life stimulus. So our conditioned stimulus would be a spider. So maybe you take them to see a real life spider. Maybe you go to a pet store and there's a spider there. So that would be considered flooding because they're being exposed to that real life conditioned stimulus. Another option would be to ask the client to imagine that they're seeing the stimulus. Imagine that you're seeing a spider. And that technique would be called implosion. So flooding is what happens when you actually get exposed to that stimulus. Implosion is when you just think about how you would feel if you saw that stimulus. So now our exposure idea is a method of extinction where we're basically trying to learn something or unlearn something, really. We're trying to lessen the relationship between our conditioned stimulus, the thing that we've learned is scary, and the unconditioned stimulus being attacked by the thing. So we're realizing that we thought that this was scary, but we've now learned that it isn't as scary. So we have broken this idea of our conditioned stimulus. We're no longer having our conditioned response to it because we've learned that the conditioned stimulus isn't directly related to our unconditioned stimulus. So seeing a spider is not the same as getting attacked by one. So that's kind of like unlearning a relationship. Another thing that we can do is what's called systematic desensitization. So it's another learning-based treatment. This one is really good for anxiety disorders. But in this case, we're going to use something called counter conditioning. So this idea of counter conditioning is meant to replace our conditioned response. So usually we have our unconditioned stimulus, the thing that's producing fear automatically. We used our being afraid of spiders because spiders bite. So spiders biting or attacking is our unconditioned stimulus from that example. Our conditioned stimulus then is the thing that we've learned to associate with the thing that we find scary. So just seeing a spider becomes associated with spiders attacking. So in this case, we're trying to replace our fear response to seeing spiders with something else. So you're counter conditioning by introducing a new response, a new conditioned response to seeing the thing that would have scared us. So the steps that you'd follow to go through this counter conditioning is you start training that client with muscle relaxation skills. So if their usual response is to be anxious, you're going to tense up. You're going to start breathing quickly. You're going to have a fear response. So that's the anxiety response that starts happening. But if you train someone to go through muscle relaxation, to practice deep breathing, to focus on calming themselves, you can't be both anxious and relaxed. They can't coexist. So you're overriding or counter conditioning your body to have that relaxation, that relaxing response to something that previously had made you anxious. So once the client has figured out how to sort of calm themselves, once they have these relaxation skills, the therapist will get them to build a stimulus hierarchy. Basically, make a list of things that cause you fear. So this doesn't have to be just a single item from a phobia. This could be your whole life. So what is something that causes you low anxiety? So on a scale of 1 to 10, where 1 is you're not scared at all, and 10 is you are scared out of your mind, what's something that ranks as a 1? Maybe you don't mind texting one of your friends. That's not bad. It doesn't cause anxiety. Maybe you get a little bit of anxiety talking to someone you have a crush on. So that would be our low anxiety item. And you can go on and on. So the therapist will have them build a hierarchy of sort of about 10 to 15 items that range from sort of very low anxiety or no anxiety up to very high anxiety. And then the goal is to go through that relaxation that you learned as you sort of work your way up that hierarchy. So it's going to be a little bit easier to get yourself to relax when you're facing one of those low anxiety situations. So maybe they ask you to imagine talking to your crush. It's a little bit anxiety inducing, but a couple of deep breaths and like forced muscle relaxation and you're okay. But as you work your way up that hierarchy, as you work to more difficult and more anxiety-inducing scenarios, maybe you have to try a little bit harder to do the relaxing. Now, this sort of working your way through that hierarchy would be called desensitization, and that would be a desensitization session, because you're sitting with your therapist and you are working to desensitize yourself to that particular response. So you're forcing yourself to be relaxed when facing that specific setup. And you can have different kinds of desensitization exposures. So you can have in vivo desensitization, where you would have a controlled exposure to real life situations. So if you're sort of only a little bit scared of ants and you're very scared of snakes and you're terrified of spiders, then maybe the first day or the first session you'd go see some ants and you'd make yourself relax. Then you'd work your way up to going and seeing snakes and force yourself to relax, and so on and so forth. Work your way through the hierarchy. The issue with the in vivo desensitization, because it's a real life scenario, it's going to end up creating more anxiety than just systematic desensitization, what we talked about before, where you were just imagining that scenario. So it's a little bit easier to imagine the scenario. It takes a little bit more to do it in the real world. The interesting part, though, is that a lot of times, if you can get someone to face the physical thing, if you can get them to see it in real life, and they can still go through the desensitization process, if they can force themselves to relax, you might see a more rapid reduction in anxiety because they faced something that was more scary. So sort of a higher risk, higher reward with the in vivo desensitization. But it's not always feasible. It has to be a controlled exposure. There are certain things you can't be exposed to safely, and so on and so forth. And there's some really cool ways that you can do desensitization with, say, virtual reality or other setups like that. But yes, again, a very, very cool topic that we don't have tons of time to focus in. Another way that we can use classical conditioning to treat different types of psychological disorders is through a process called aversion therapy. So for aversion therapy, we're basically going to train up a new classically conditioned association. So the idea here is to condition some kind of aversion or negative response to a conditioned stimulus, a thing that you are going to learn to associate with something bad. So if we have here our conditioned stimulus, in this case, they're talking about, say you have someone who's a pedophile. And so you're trying to rehabilitate them by no longer wanting to look at children. So you might have your conditioned stimulus, the thing that you're trying to make them not want to look at. So if you have just pictures of kids playing at the park, that is our new conditioned stimulus. It's the thing that we're getting them not to want to look at. If we pair that with an unconditioned stimulus, a thing that is going to cause you to respond poorly, like an electric shock. So if every time they see a picture of a child, they get a physical, a painful shock, then it's going to create an association between the two, and it's going to cause a new emotional response. It's going to cause a conditioned response. And in this case, it's a conditioned anxiety response. So they've learned that when they see pictures of kids, they will get a physically painful stimulus. So they learn to brace for something painful whenever they see that kind of image. And so our desired outcome is that instead of them enjoying looking at something we don't want them to be looking at, we can now reduce their physical response to that by replacing it with a negative response. So we've made them have an aversion to the thing that they were originally doing. Now, talking about a pedophile is a very extreme case, and this has been successfully employed in the past. But it could be something as simple as like alcoholic drinks. If you're trying to get someone to stop drinking alcohol, maybe you have an alcoholic in the family. You could use this same process where our conditioned stimulus would be our alcoholic drink. If you pair it with something that tastes bad or smells bad, this noxious or bad tasting or smelling unconditioned stimulus. So maybe you put a really gross essential oil in their alcohol. So every time they drink, they associate it with something that tastes awful or something that smells awful. Then you can cause them to have that sort of disgusted response to the conditioned stimulus, to the alcohol. So over time, whenever they think of alcohol, they think, ew, gross. So you reduce that behavior by pairing it with something bad. So both cases, we're conditioning an aversion to something that they would have wanted to see or drink or whatever. So a couple of, actually quite a few ways that you can employ this setup. Next, we're going to talk about operant conditioning treatments. These are also sometimes called behavior modifications. So this is how we're going to modify behavior. So the difference between operant conditioning and classical conditioning, just as a quick refresher, our classical conditioning is something that's sort of a gut response. You don't choose to develop a fear to spiders. You don't choose to develop an aversive response to a shock. It's just going to happen. So it's sort of a gut response. It happens automatically. It's learning, but it's not something that we're consciously in control of. In contrast, operant conditioning is when you're choosing to have a response to a particular stimulus. So it's a little bit more of an active process. And that's a very simplified definition, but it's sufficient for this part of the course. So when we're using these behavior modification techniques, you can use things like reinforcement or punishment. Reinforcement is a way of getting someone to do a behavior more often. Punishment is getting them to do a behavior less often. Extinction is getting them to stop doing a behavior at all. So there's a couple of different terms. And again, I'm going to keep it very, very brief here. So you can attempt through all of these different methods to increase or decrease a behavior. So if you want someone to do something more often, maybe you're going to reinforce that behavior. You're going to make them do it more often. If you want to reduce that behavior, maybe you're going to use punishment. You're going to get them to do it less often. Now, this kind of treatment isn't necessarily used all the time, but it can be really successful in cases where traditional therapies are really difficult to implement. So specifically in populations or groups where it's really hard to do something like a standard sit down and converse with a therapist kind of therapy. So in situations like profoundly disturbed children, individuals that have developmental disabilities, or in groups that aren't great at sitting and conversing, say people who have schizophrenia or other types of psychological disorders that affect your ability to participate in what we normally think of as therapy. So we can talk about a specific example of using this operant conditioning treatment in a group, originally designed for a specific group, especially in terms of positive reinforcement. So we're going to look at token economies. And this was originally proposed back in the 1960s in order to try and help treat and correct behaviors of individuals who had been hospitalized with schizophrenia. And so these token economies were set up as a system to try and strengthen desired behaviors by using positive reinforcement. And so you might remember from 104, so we already talked about reinforcement as being you're trying to increase the desired behavior. And if it's positive reinforcement, you're trying to increase that behavior by adding something. So positive meaning that you are adding something. Now in this case, the thing that was being reinforcing were tokens, hence token economy. So if somebody did something that was good, if they washed their hair, if they displayed appropriate social responses, if they cleaned up after themselves, if they did the job they were assigned, they would be given a token. And then these tokens could be exchanged for some kind of tangible reinforcer. So the idea here is that they could take the tokens that they earned through their good behaviors, their desirable behaviors, and exchange them for something that they wanted, something tangible that meant something to them. So you could redeem your token for getting to use a particular room, or getting control of the TV set or the radio, getting the option to go outside or play a particular game or something like that. So they could exchange these tokens for something that mattered to them, something that they would find reinforcing. And so our goal here is to increase the occurrence of those desirable behaviors, those desired behaviors, the things you want them to be doing, using these reinforcers. Now, the cool part here is that the use of tokens, instead of immediately being given one of these tangible reinforcers for doing the behavior, actually introduced a little bit of distance. So you would do the good behavior, and then you'd have to wait a little while to get your tangible reinforcer. So people weren't just doing the good behaviors because they immediately got rewarded for it. The tokens let them know that they did the right thing, but they didn't get that positive reinforcement, that feeling good, until a little bit later. So that helps us have things like social reinforcers and this self-reinforcement process, like being proud of yourself, to also play a role. So by not immediately just feeling glad that you got food or access to the TV or something, there was some time for other kinds of reinforcement to play a role as well. And so, again, there's a whole lot we could talk about with token economies, but it's a very nice or a very well-rounded system that tends to work in very specific environments, and it's set up to work from a couple of different angles with tangible reinforcers and social reinforcers all at the same time. Now, of course, if we've talked about reinforcement, that always raises the question of punishment. So punishment is when you're trying to reduce the occurrence of behaviors. So if you want someone to stop doing a bad behavior, you might do so using punishment. And we don't go into a ton of detail here. You can have positive and negative punishment where you can make them stop doing something by adding something. So if you yelled at someone to make them stop doing a behavior, that's positive punishment because you are adding the yelling that they don't necessarily want. But you can also have negative punishment where you take away something to make them stop doing it. So if a kid's throwing a temper tantrum, maybe you take away their toy until they behave. So a couple of different forms of punishment, but even the word punishment makes us automatically assume that there's something bad here. Because punishment is making people stop doing it, and you think of things like spanking children or yelling at people or whatever. So punishment isn't necessarily a positively viewed thing. So if punishment is to be used to try and control behavior, we have two questions that we want to consider. The first is, are there alternative, less painful approaches? From the way this question is worded, they're specifically focusing on things like positive punishment, yelling at someone, spanking someone, things like that. So you are doing something to make them not do a particular behavior. So if there is another method of getting them to stop this behavior, if we could use any of the other therapies we've talked about so far, and if that would help reduce this behavior, then we should go that route first. The second thing is the behavior to be eliminated sufficiently injurious to justify punishment severity? So is the person doing something that is bad enough or harmful enough that it needs this level of punishment? So if you're just trying to get someone to stop snapping their fingers whenever they think of something, that's not necessarily a harmful action, and it wouldn't necessarily justify smacking them with a fly swatter every time they do it. What if you just ask them to stop? But in some cases, this behavior can be sufficiently problematic, can cause harm to the individual doing it or to other individuals in the area where it justifies punishment. And of course, there's the caveat of the use of punishment never happens without the consent of the client, the person who's doing the behavior and being punished, or the client's legal guardian. And that's in place in case people are employing punishment for those who aren't capable of being their own advocate. So these are individuals who maybe they're children, they can't speak for themselves, they don't have the ability to understand what's going on to give consent, or individuals who have reduced mental capacity, or maybe they have a particular type of disorder that inhibits their ability to give proper consent. In any of those situations, their legal guardian would have to be the one who gives consent. Now, with all of those caveats taken into account, all of those hoops that need to be jumped through, all of those boxes that need to be ticked before punishment can be used, in some situations, punishment can actually be very effective. So if we consider children who have, say, self-destructive behaviors, say individuals who repeatedly bang their heads against surfaces, or pick at their own skin, or cause themselves harm, in situations like that, you could use punishment to try and reduce those behaviors. So maybe you deliver a mild electric shock anytime the child starts hitting their head against the wall. And that shock might cause them to stop the behavior of hitting their head against the wall. So in that case, there isn't necessarily a less painful approach to interrupt that behavior, especially not one that's going to teach them to stop doing it. And the behavior is sufficiently injurious to justify a mild shock. So we've kind of ticked off all those boxes there. Another approach that we can use is called modeling. Now, humans use modeling all the time, where we see someone do a particular behavior and we learn from watching them do that behavior how we should act. A great example of this, if you come up to a stretch of road that's recently under construction, you've never been on this stretch of road and now it's under construction, there's pylons everywhere, you don't know where to go. But there's somebody ahead of you and you watch where they drive through the pylons. So you model their behavior, you copy their behavior to know how to appropriately and effectively get through the construction. We can do that with all sorts of different skills. Kids watch adults in how they interact with others to learn different behaviors. So we can use this, we can co-opt this ability to try and teach people to behave in the correct or desirable way. So the first way we can talk about this is something called social skills training. So it's a modeling approach, hence the spiel I just gave. But the idea is that you would learn new skills by observing someone who is already skillful. So you would observe an adult come into the room and have a conversation in a very particular way, or interact with someone in a certain way. And then you would imitate that model, that adult, because they performed a socially skillful behavior. So you want to imitate them. So by doing that, you're going to learn how you should act in that situation. And of course, our key factors is that we're trying to increase self-efficacy. We're getting people to know how to behave and to feel competent in that situation. So they believe that they can. If they believe that they can, then they're more likely to be able to do so. So if they see someone do it, they think, I can do that too, then they're going to go and do it too. Whereas if they had to face that situation with no idea what they were doing, they might be less confident, they would have less of a belief in themselves, and they might not do as well.